Hey, I'm Kate. I'm a nurse practitioner who specializes in treating hypermobile people who live in the world of hypermobile EDS with MCAS and POTS, a lovely little triad, if you will. Most of my patients have a really hard time with movement and a really hard time knowing where to start if they have been down and out for a while and they're trying to get moving again, or if they just never really connected to movement or just have too much pain with movement. They go, what do I even do? And I have a lot of different recommendations of places to start, but truly it does have to be something that really feels right to each person as an individual. But what I can do is put together some options of some things that I do often recommend as a lovely starting place for people. And you can take what feels good for you and just forget anything that you're like, absolutely not, that's not for me. The very first thing that I start with my hypermobile people who haven't been moving or having a lot of pain is posture. Posture problems are pain problems. When we have chronic pain, we have chronic posture problems. So starting there is really important. When I teach people about posture, it is sometimes like a coming home, depending on what they did when they were growing up. If you were a dancer or a gymnast, or which a lot of hypermobile people end up in those areas because we thrive. If you lived in that realm, then a lot of times it's like coming home and you kind of remember, oh yeah, my body knows how to do this. I just haven't been doing it. But for my people who don't have that good foundation of movement, it can be really overwhelming, and that's okay. I'm going to break it down really slowly here, and then I'm going to show you increasingly how it looks when you are able to kind of put it all together. But everything takes practice, so don't beat yourself up if you feel like a turkey sandwich the first time you do it. The very first thing that you want to do is make sure that your feet are planted on the floor. So feet that are rolling in like this is called pronation. This is going to mess up your alignment all the way up. If we're leaning our feet out to the side, this is called supination. Same thing. If we're leaning out to the side and we're putting pressure on the outsides of our feet and we're not evenly spreading our feet, then that misalignment is going to travel upwards and it's going to cause pain in different places at different times, but it will cause pain. So the first thing you want to do is make sure that you are truly planting your feet on the floor, spreading your weight out among the feet, spreading those toes out so that they aren't crunched and curled up, and really feeling your weight evenly spread on that foot. For some people, that's going to be the workout for the day, is trying to figure that out, especially if you have a lot of ankle instability. Once we have our feet planted, the next place, we start from the bottom and we work our way up. So the next thing we want to pay attention to is our knees. Lots of hypermobile people have hyperextended knees. If you don't, then yay for you, but most of us do to some extent. So when we're hyperextending our knees, it looks like this, right? We've got this scooped out Barbie leg in the back. It's like the 90s Barbies is how those ones were. We've got this hyperextended knee, and then usually we're pushing forward in our hips to counterbalance there. We don't want to do that. We want to find our nice neutral knee. Now, we start again with those feet, plant, 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 spreading my toes, nice even weight. See, my knees now look like they're a little bit bent. They're not. They're straight. They just look a little bent because you watched me do this before. So they look a little bit bent. They feel a lot bent. If you're a hypermobile human who's used to locking those things back, it feels weird. So this takes practice to get used to this place. You will feel some muscles engaging, especially right here, that you're like, the hell is going on? That's fine. They're just waking up. They're not used in the same way when we're locking back like this, right? So you find that neutral knee that feels really bent, but it's not. The next thing is this, what I call our duck butt. A lot of us, we either kind of push forward in our pelvis like this with these locked back knees, or we keep those knees locked back and we keep our derriere back there too. We don't want to do that. We find our nice neutral knee. We take this pelvis and we go and we stack it straight. So it went from this tilted forward position to nice and in line. And now from our hips down, we are perfectly in a nice straight line. For some of you, you're going to need to pause here before you start working on other parts because this is going to feel wonky enough. But if you're ready to keep going, let's keep going. The next thing you want to do is engage the belly. So we don't want these like open kind of abdominals with our ribs splayed out. We want to think about closing this rib cage. It's not a hard close. It's not I'm crunching and I'm contracting. It's a soft close. We're lacing our shoes up, but we don't want to lace them up too tight because then, ouch, we're going to be putting pressure on places that we don't want to be putting pressure. So it's a gentle close and then an engagement here in our belly. You always want to think about your belly button heading back towards your spine instead of this outward position. It's everything is coming together gently, and then the belly button scoops back towards the spine. The next thing you want to do is think about your shoulders. Many of us live in this posture here or this posture here. This is really common when we are people who live in complex PTSD land, or certainly people who work on a computer a lot, which is like all of us at this point. We get this like rounded protective posture. So you want to think, oops, let me open these shoulders up and push them down. Not aggressive, right? Like we're not trying to create new tension spots. It's about opening and softening, okay? The very last thing I have people do is pretend like there's a string coming from the top of your head, or, oh, look, I have a ponytail. And you're going to take this and go and really lengthen that neck. That one freaks people out when I do it to them in clinic. I'll often just take my fingers and go like this and gently elongate for them, and they go, whoa, and they grow 3 inches because, again, we sit in this kind of turtleneck, hunchy position. We open and gently put those shoulders back, open the chest, and then we're lifting so that we have this nice neutral neck and it's nice and elongated. And then we're fully stacked. So that's a lot of steps. But really what you want to think about is I'm starting from the bottom and then I'm working my way up. If we don't start from the bottom, nothing on top matters. Because if we aren't starting from the bottom, specifically with our feet, making sure we're getting that nice firm plant on the floor, then the rest of the alignment, even if it looks perfect on top, it's going to be causing pain problems, and we don't love that. So when we're able to practice this regular posture improvement over time, you notice, okay, I'm getting stronger in different places. It's becoming more like a muscle memory to go back to this neutral place, and then you'll notice a reduction in your pain over time. When you're ready, when you've been practicing this and it doesn't feel so chaotic, it can look really quick. So often I'll find myself talking to people and I'll be like doing the typical hypermobile thing, right? Where we're like jutting a hip out and all my weight's over here. And then I go, oops. And so I'm quickly gonna go, okay, feet planted, neutral, knees up, close, whoop. And then here I am back in neutral. And honestly, I'm not even going to be doing this, right? I'm going to go from here and I'm going to go, oh. And it just is that quick. But when you start thinking about posture, it pays off to go piece by piece to really take your time to find those perfect neutral positions. So that's my number one first recommendation for hypermobile people who are like, I'm in pain. I don't even know how to move. The first thing that you can do is really work on your posture, because a lot of times just finding this posture and holding it for an extended period of time, that's the workout. And there's no shame in that. That's fine. Let that be the workout, because it's important and it will help you so much in the long term.